Okay, it's Fort Myers, Florida, September 2018. I am Dr. Scott Geller, the go-to floater guy, I think. And we have a great patient here from Estero, Florida. You had cataract surgery, what, 5, 6 months ago, was it?
March.
March, okay. And after the surgery, you had an issue, and you had a very competent, cataract guy. He did a nice job. I can see that. How many months after the surgery did you notice this issue?
Almost immediate.
Immediately. And you can see it, what it is right here. This is day one here. See that big floater? Bam, got it. Anyway, when you described it to your doctor there, he was a little befuddled, and I know him. I've met him. He's a competent surgeon, but I don't think he asked the right questions to understand what you were talking about. You said, I've got this vertical thing in my field of vision, and he didn't really understand what you were talking about, because your vision is very good, uncorrected.
Right.
You can see the eye chart well. They look at that and they say, well, what do you mean there's something wrong? Everything's perfect. So he sent you to a very prominent retina guy here, Dr. Wafapour,
That's right.
who made the correct diagnosis. He said, well, you got a floater that's sort of like a strand, and it's maybe vertically oriented, dead center in your visual axis. And that happened after cataract surgery. The vitreous gel has a little more wiggle room when the natural lens of the eye is removed. The gel can be displaced forward. We call that a posterior vitreous separation or posterior vitreous detachment. It's not a retinal detachment. And you get stuff like that. And that was very disturbing to you. You had to, move your eye to get it out of the way, but...
Well, I couldn't get it out of the way.
You couldn't
That
get it
the
out. It was always
frustration,
pretty
yeah.
much central. But anyway, Dr. Wafapour saw what it was. He's, like I said, a prominent retinal specialist here. He sent you over here to me, and we got it, didn't we?
You showed me it.
We got it with laser. It's kind of... It's hard to get ophthalmologists out of the mental state that they have to take the time to ask the proper questions. What do you mean this is a vertical thing in your vision? Because sometimes the patient doesn't use the same terminology that an ophthalmologist might
Okay.
use. And so because they can't communicate, or their patient is not using the same language that we use, they become a little befuddled and send you for another opinion. And at least opinion number 2 understood what was going on. He sent you over here, 3 laser sessions,
Right.
and I think that's enough. You still said you had a little tiny thing persisting, but more is not better in this game. It's like breast implants, bigger is not better.
Right.
There's a right point to stop. You're at the right point, and we got it. That's what's important.
I was very happy about that.
You're a happy patient. I'm a happy doctor.
And
My
we're
lovely
happy.
staff is happy too. We're all happy. This is why we continue to do this. It gives us great ego satisfaction to get the result when other doctors don't seem to be able to. I always say I'll be like the artist Van Gogh. After I'm gone from this world, they'll say, oh, this guy was really right. It's funny. Anyway, you're a great patient.